Edna Register Boone was 10 years old and living in the small Houston County town of Madrid when an epidemic of influenza struck her town in 1918, killing many of her neighbors and playmates. Her parents and siblings were among the few in the town who didn't contract the disease, she recalled in a 2007 interview with Ann Brandley of the Alabama Department of Public Health. Boone, who was 100 years old and living in Mobile at the time of the interview, said her family came to the aid of neighbors. "My parents became automatic nurses, they nursed every family in town," Boone said. She recalled the disease took entire families. "My father and Uncle Eli dug a common grave and buried 3 people in it, mother, father and a young daughter," said Boone, who died in 2011 at the age of 104. People were buried in the clothes they died in and wrapped in sheets. Houston County was not the only place to suffer the effects of flu that year. Less than a year after the United States entered World War I, an unprecedented outbreak of influenza swept the world, killing more people than the war. An estimated 16 million people were killed in World War I, but officials estimate 20 to 50 million died from the Spanish flu pandemic of 1918. It caused more deaths than any other illness in history, according to the National Archives. And, according to the Centers for Disease Control, the outbreak is still affecting us. All strains of the influenza A virus that make us sick today are descended from the flu of the 1918 pandemic. Read more. No one knows how many died in Alabama. Authorities found it impossible to count the number of dead, as cases erupted too quickly for accurate record-keeping, according to health officials speaking at a 2006 state summit on the 1918 pandemic. It is impossible to know for sure exactly how many Alabamans were affected by the flu, since regular reports to the U.S. Public Health Service were never made. But it is known that during the last 2 weeks of October, more than 37,000 cases of the flu erupted in Alabama. People around the state died by the hundreds, said Michael Lovett with the Department of Health and Human Services in his remarks at the Birmingham summit. A mass grave in a Sheffield cemetery's Paupers Field illustrates the difficulty authorities had in keeping track of flu cases and deaths. The burial site in Oakwood Cemetery is believed to be the final resting place of as many as 100 flu victims, according to a 2015 article in the Times Daily. Researchers are attempting to identify those buried there, many of whom are thought to have been workers constructing Air Nitrate Plant O2 on the TVA reservation in Muscle Shoals. The beginning, although some sources state the pandemic began in January 1918, the first officially reported cases of flu in the U.S. were at an Army camp in Kansas in March of that year. In Alabama, most sources agree the first cases were reported that September in Huntsville. The disease soon spread throughout the state, according to the Alabama Department of Public Health. Scientists, doctors, and health officials could not identify this disease which was striking so fast and so viciously, eluding treatment and defying control. Some victims died within hours of their first symptoms. Others succumbed after a few days, their lungs filled with fluid and they suffocated to death, the National Archives reports. Even after determining the strain of the disease, referred to as the Spanish flu, health officials could not stop it. What made it so insidious is that it infected even healthy, young adults, who developed fluid in the lungs that led to pneumonia, the cause of death listed in many cases. It struck in both rural communities and urban centers, leading to shortages of medical care and supplies. In many towns, people relied on neighbors to nurse the sick. Soldiers stationed around the world wrote letters home describing flu cases on their bases. Thousands of soldiers who survived the war were killed in the epidemic. In some states, according to an article at Stanford.edu, people had to abide by strict ordinances meant to stop the spread of the disease. Those who were lucky enough to avoid infection had to deal with the public health ordinances to restrain the spread of the disease. The public health departments distributed gauze masks to be worn in public. Stores could not hold sales, funerals were limited to 15 minutes. Some towns required a signed certificate to enter and railroads would not accept passengers without them. Those who ignored the flu ordinances had to pay steep fines enforced by extra officers. Bodies piled up as the massive deaths of the epidemic ensued. In Alabama, the first Alabama counties struck were Madison, where Huntsville is located, and Conecuh, according to a history on the State Department of Public Health site. On October 5, 1918, the Birmingham News reported that more than 1,100 cases were counted in Huntsville by Dr. Agrote, health officer of Madison County. 2 days later, Governor Charles Henderson began closing schools, churches and theaters in hope of curtailing the spread of the disease. Read more on October 13, the Birmingham News reported, a desperate situation exists in Huntsville growing out of the Spanish influenza epidemic. All druggists, physicians, and prescription clerks, except one, have been stricken with the disease, and a distressing appeal reached Montgomery last night in telegrams for immediate help for the stricken city. That same day, 2,000 cases were reported at Camp Sheridan near Montgomery. The number of victims in the capital city would grow to 12,000 cases by the end of October. Cases were still being reported through late 1919, although some sources placed the end of the epidemic in early 1920.